Schwartz Centre rounds are a meeting for staff who come together from across the hospital or sometimes in a hospice or community trust to talk about the issues that arise for them in caring for patients. They last for an hour. The first part of that hour is a team who have looked after a patient presenting the story of that patient and how the care affected them in some way. You'll have 3 or 4 different professional backgrounds represented talking about the impact from their point of view. For the rest of the hour, the discussion's opened up to everybody who's there, and the facilitator, who is a trained person to help guide or encourage discussion, helps them to explore issues that have arisen that might resonate with them.
One of my particular roles is to go through the ground rules at the beginning of the rounds, ensure that people understand that they're confidential, that they're a space for reflection. It's an opportunity to have a different kind of dialogue about providing clinical care, and that that the aim of the round isn't to do problem solving.
You need to have a high-profile doctor who is the clinical lead for the rounds, who attends all the rounds and introduces them and perhaps helps to facilitate the discussion.
So the rounds are multidisciplinary, so we can get people attending and presenting from all sorts of different professional backgrounds. And it means that they stop people working in their silos. People have a much greater understanding of what their colleagues, the issues that their colleagues are dealing with. And sometimes it's been really rewarding hearing during a round people saying, I never realised it was like that for you.
We also encourage non-clinical staff to attend and non-clinical staff to present. We've had, for example, porters, security guards, housekeepers presenting. When a hospital or a trust signs up to do Schwartz Centre rounds, you must have the support of the board and the chief executive. But that doesn't really mean anything unless the chief executive, board members actually attend rounds, are actually visibly seen to be there. And we've seen that in the organisations where they do come regularly, that it has a really good impact on staff. The whole issue of compassionate care is very much in the media, in the news, and staff are being berated for not being compassionate enough or being urged to be more compassionate, and it's very difficult, it's complex, and the issues that come up are very often to do with staff feeling stressed or feeling that they want to give more, and for various reasons they find that difficult. The team that present often say that the reason they could care for that patient in the way they did was because they had support from each other in the team.
And healthcare people are under a lot of pressure. People are very busy, very stressed, and very stretched. And the rounds really help put patient back at the centre of care, the patient and the family, because what they enable people to do is to attend to each other, and in hearing the patient's stories, attend to them and their relatives as well.
The participants who attend report that there are huge benefits for them as individuals, but also they report better communication and better relationships between them and their colleagues, between colleagues they might not have understood or known about before, and also that some things about the culture of an organisation shift and change. We know that the people who attend the rounds say that they feel that the way they communicate with patients, the way they talk about feelings and emotions with patients changes and improves, and they're not so frightened to talk about difficult issues with them.
What we hope, and what the research is beginning to show for the rounds, is that greater understanding for their colleagues then also spills over into a greater sense of compassion and empathy for patients.